Hi everyone and welcome to our presentation. Today our presentation will be in two parts. The first part will be the nutrition review. So we will go over how to be successful with the modified liquid diet, guidelines for vitamin and mineral supplementation, and diet advancement guidelines. Jocelyn, our bariatric coordinator, will be going over our preoperative preparation, and she'll review specifically final steps prior to surgery, anatomy of surgical procedures, and how to stay hydrated and prevent blood clots after surgery. So for the 2-week modified liquid diet, this is a very, very powerful preparation tool. Again, you'll start this 2 weeks prior to your weight loss surgery. The purpose of the pre-op diet is to shrink your liver. So when your liver is large and if there's any fat that's infiltrated in your liver, it makes it very difficult for the surgeon to safely operate on your stomach. So over the course of the 2 weeks on a daily basis, you'll be consuming about 800 calories a day to help shrink your liver prior to surgery. Again, it's really designed to physically and mentally prepare yourself for surgery, physically to help shrink the liver and help you lose weight prior to surgery, and to mentally prepare yourself for surgery because you will be consuming a very high protein, low calorie, low carbohydrate, low added sugar diet. This next point here is very important. If you take any medication to help control your blood sugars, really any insulin or even any oral medication, please call your doctor who prescribes the medication, whether it's your PCP or your endocrinologist. It's very important to touch base with that physician and let them know that you'll be on a very low calorie and low carbohydrate diet for 2 weeks prior to your weight loss surgery. This table is listed in your binder. In the middle column there, this includes everything that you can consume on the diet 2 weeks before surgery. So everything that you can consume, you can do plain grits, cream of wheat, oatmeal. Make sure that this is a very soupy and runny consistency. Diet vegetable juice you can do as well. Make sure that it has less than 50 calories per serving. An example is Diet V8 Splash. You can do diet fruit juice as well. This includes Diet Ocean Spray cranberry juice. That has many different flavors that you can choose from. Also, the dairy products that you can consume, skim milk or lactate-free milk. You can also do any soy milk, almond breeze, things like that. And there's a couple that are listed here. Make sure that there's no added sugar. You can also do low-fat cottage cheese, low-fat Greek yogurt without any sugar added to it. Opioids 000 is a good example of an appropriate Greek yogurt that you can consume. Some other things you can consume is plain canned tuna or salmon. You can do egg whites or egg substitutes. You can also do protein bars and protein shakes, and also protein powder as well. Just make sure that the protein bars, protein shakes, and protein powders have less than 200 calories per serving size, less than 10 grams of added sugar, and at least 20 grams of protein or more. You can do fat-free broth as well, and low-fat cream soups. An example of low-fat cream soups would be the Campbell's low-fat cream of mushroom or cream of chicken soup that has right on the front of the label, it says 98% fat-free. So that's a good thing. You can blend it and strain it, and it gives you a little bit of a different consistency than your regular broth. You can also do Equal, Splenda, Sweet and Low, Stevia, Truvia. You can add that to your decaffeinated tea or coffee to kind of give you a little bit of flavor. You can also add that to your plain grits, cream of wheat, and oatmeal as well. Sugar-free ice pops, low-fat sugar-free pudding, sugar-free gelatin you can do as well. Overall clear liquids, your low-calorie, low-sugar, decaffeinated, non-carbonated clear beverages are things that you can do as well. Your Crystal Light water, obviously, Diet V8 Splash, Diet Kool-Aid, decaf tea, and decaf coffee. The biggest thing to take note, and this is also listed in your binder, but the types of foods that have calories in it, we need you to consume 4 to 6 ounces every 3 to 4 hours throughout the day. Things like your water, your Crystal Light, your Diet Lemonade, Diet Kool-Aid, Diet Ocean Spray, those are the types of things that you can do kind of, throughout the day as much as you want to stay hydrated. So just a brief review on how to read the nutrition label. So on the left here, your clear liquids must have 10 grams of sugar or less per serving, and you can see right on the nutrition label where that's located. And usually on the packaging it should say sugar-free or no sugar added. Protein powder or ready-to-drink protein shake should have 200 calories or less per serving, 20 grams of protein or more, and 10 grams of sugar or less. We do have a list of appropriate different ready-to-drink protein shakes and protein powders that you can choose from that do meet this criteria. So now I'm going to talk to you about vitamin and mineral supplementation. So this is very important for all surgeries. Per the ASMBS guidelines for vitamin and minerals for both the gastric bypass and sleeve gastrectomy are the same. And this is overall what's recommended, again, per the ASMBS guidelines. So what's listed in this table incorporates a lot more than what your typical complete adult multivitamin would include, okay? So take note down here, your iron, you need at least 18 to 16 grams per day, and you cannot take it with calcium. And note down here, your calcium recommendations, 1,200 to 1,500 milligrams of calcium per day. Your body will not absorb more than 600 milligrams of calcium at one time. So your calcium should be taken either in 500 milligram or 600 milligram serving sizes at one time. Okay, vitamin and mineral supplementation, complete bariatric multivitamins. The required vitamin and mineral supplements are available in all-in-one products. These products are cost-effective and will decrease the number of supplements you need to purchase and simplify the routine of taking multiple supplements at different times throughout the day. All multivitamins should be chewable for the first 3 months after surgery. And we want you to start taking your vitamins and minerals the day you get home from surgery. You will have to continue taking the vitamin and minerals supplementations for the rest of your life. So this is an all-in-one option. This Bariatric Fusion 4 for Life multivitamin is listed in your binder. It is actually the last one listed in the table in your binder. You will only have to take 2 chewable tabs in the morning and 2 chewable tabs at least 4 hours apart from that. This includes overall 1,200 milligrams of calcium, 45 milligrams of iron, 560 micrograms of vitamin B12, and 3,000 IUs of vitamin D, which is meeting everything that you need. So if you were to purchase this one, you don't have to take anything else in addition to this, okay? You don't have to take additional calcium, you don't have to take additional iron, B12, B complex, anything like that. Just the 2 in the morning and 2 at night. And 1 bottle will last you for 1 month. This is the all-in-one option number 2 that a lot of people also get. This O-Purity by Undri includes, it's 1 chewable tablet that you would take that includes 45 milligrams of iron, 500 micrograms of B12, and 75 micrograms of vitamin D. So because you're taking all of your iron at one time, you will have to take additional calcium with this. Okay, this is in your binder, the second to last one from the top in the table. On the next page, there are calcium supplements that you can kind of pick from and purchase to take in addition to this. 1 bottle of this O-Purity multivitamin will last you for 3 months. This is the same table here that is in your binder. So again, this is the Bariatric Fusion multivitamin. If you choose to get this one, you don't have to purchase anything else. This is the O-Purity multivitamin that I had just talked about. You only have to take 1 chewable capsule with calcium. This Celebrate Multi-Complete Chewable Multivitamin, if you decide to choose this one, you need to take 2 chewable tablets, and then you'll have to take additional calcium with this. Same thing with the Bariatric Advantage. You'll have to take 2 chewable tabs, and then you will have to take additional calcium with that, okay? So vitamin and mineral supplementation, calcium supplements. So again, it's recommended for both the sleeve gastrectomy and the gastric bypass to supplement about 1,200 to 1,500 milligrams of calcium at one time. Calcium citrate or calcium carbonate can be taken. Calcium citrate can be taken on an empty stomach or with food. Calcium carbonate should be taken with meals. Your body can only absorb about 500 to 600 milligrams of calcium at one time, so calcium supplements will need to be taken 2 to 3 times throughout the day depending on what the dosage is. So if you found one that has 500 milligrams per dose, you'll have to take it 3 times a day, at least 4 hours apart. Or if you were to do a 600 milligram calcium tab, you'll have to take 2 of those at least 4 hours apart, okay? And just know that if you have any questions, you can always reach out to me, and we can always go over an individualized vitamin and mineral supplement schedule at your appointment in the office. Again, this is very important. Do not take calcium and iron supplements at the same time, as they interfere with the absorption of each other. Please take your calcium and iron supplements at least 2 hours apart from each other, and each calcium dosage should be taken 4 hours apart from each other. Okay. Vitamin D is very important for the absorption of calcium. It promotes healthy bones and teeth, cell growth, weight loss, prevention of some cancers. Some symptoms of deficiencies include muscle pain, bone fractures, fatigue, low immunity, depression, problems sleeping. It can be found in fortified dairy products, and also you can get vitamin D from the sun. Symptoms of calcium deficiency include fatigue, depression, tingling and numbness in your upper and lower extremities, tooth decay, memory loss. And then to the right, here's a little graphic of what osteoporosis can look like. Just note that osteoporosis, at a significant level can happen at any age. So know that. Okay. Thiamine deficiencies here, this can certainly be common, especially after surgery, if you find that you're maybe not tolerating what you're consuming, whether it's your liquids or your solids, and you're vomiting, because your thiamine is a water-soluble vitamin. This could go low, and you could be deficient in it pretty quickly if that's the case. Thiamine is important for converting carbohydrates into energy. It's important for proper heart and muscle function. Symptoms of deficiency include loss of feeling or sensation in your hands and your feet, loss of muscle function or paralysis of your lower legs, mental confusion, speech difficulties. It can be found in a variety of products. It can be found in beef, pork, navy beans, nuts, pinto beans, soybeans, green peas, spinach, and bananas. Copper deficiency is something that we don't see all the time, but it's certainly something that can happen. Copper deficiency symptoms include fatigue, arthritis, osteoporosis, paleness, low body temperature or always feeling cold, anemia, brittle bones, frequently getting sick, muscle soreness, joint pain, a stunt in growth, hair thinning or balding, unexplained weight loss, bruising, skin inflammation, and sores. Symptoms of anemia include yellowing of your eyes, skin paleness, coldness, yellowing, respiratory issues, muscular weakness, changes in your stool color, fatigue, dizziness, fainting, low blood pressure, heart palpitations, rapid heart rate, chest pain, heart attack, spleen enlargement. So it's important to note that while we check your bariatric clinical labs prior to surgery, we will continue to check that after surgery to make sure that you're not deficient in any of these vital vitamins and minerals. Vitamin B12 deficiency includes mental problems, fatigue, hair problems like hair thinning, chronic pain, infertility in both men and women, and also blood disorders. Vitamin B12 deficiency is actually fairly common, but unless you take your bariatric specific multivitamins on a daily basis, you shouldn't develop a vitamin B12 deficiency. A few more things I want to go over. Some things to kind of not necessarily expect, but these things are fairly common after surgery. Constipation, so this can certainly be common because fiber is pretty low after surgery. You know, you're not consuming as much fluid, you're not moving around as much, you're on narcotics, so this can certainly be an issue. Just do the best you can with drinking enough fluids, making sure that you're getting at least your 50 ounces of water. No sugar added prune juice sometimes can help, but we don't want you to do any more than half a cup daily. You can also do some Benefiber, Metamucil, or Miralax. But if you're having any issues with constipation, please let us know. Give us a call or mention it at your office visit. Hair loss is another thing that is fairly common. So hair loss it's your body's normal response to stress and significant weight loss interfering with hair growth cycle. So the follicles overall are not damaged, but just know that as soon as your weight starts to kind of plateau a little bit, depending on when that would be, and you're consistently consuming, you know, an appropriate amount of protein, and you're taking your vitamins, your hair should grow back. Okay. Dumping syndrome is another thing. So when this also happens when food or drink empties too quickly from the stomach into your small intestine. So this happens a little bit more commonly in those who have had the gastric bypass. However, it can certainly happen in those who have the sleeve gastrectomy. However, it's not as common. So just for everyone, it's something to kind of think about. So foods to avoid include any concentrated sweets like sugar, cakes, candies, cookies, fruit canned in regular sugar or high fructose corn syrup, sports drinks, sweet cereal, agave, honey, molasses, things like that. Another thing you should avoid is any greasy food, like really fatty foods. This might also cause dumping syndrome as well. And you'll really know if you do have dumping syndrome because you'll really feel awful. Most patients have extreme diarrhea that continues. Also vomiting, you kind of feel shaky a little bit. You generally feel awful. So you'll know. And it will subside. You will get better. It's just, it's not great for when you have it. Okay, so after surgery, so the first day after surgery, you will be given a bariatric clears tray in the hospital. This will contain sugar-free, caffeine-free, carbonated-free beverages. So really the main goal is to get used to your new anatomy on this day. Okay, not necessarily, drinking to stay hydrated. So we do want you to try to sip 1 to 2 ounces every hour while you're in the hospital. You will be hooked up to an IV that will give you enough fluid to stay hydrated. Make sure that you're sitting up in an upright position while sipping to assist the pouch in emptying. We want you to avoid any straws, we don't want you to gulp, and we obviously don't want you to do any alcohol at this time. So when you go home, we do need you to bump up your overall clear liquid intake for the course of the day. So we want you to try to get at least 4 ounces every hour. So again, your liquids should be your clear liquids. It should be sugar-free, decaffeinated, non-carbonated, and clear in appearance. You can take some of those 1-ounce plastic cups home with you to prevent sipping too quickly. Again, as you're home during that first week that you'll be on the clear liquids, we want you to get used to your new anatomy. Adding protein powder to clear liquids as tolerated is okay. We don't want you to add any protein powder to your clears until you're about 4 to 5 days post-op. If you have any questions about that, again, please reach out. Usually patients don't necessarily tolerate super hot or super cold liquids. Usually at this time, lukewarm liquids feel pretty good. No gulping, no chewing gum, and no alcohol at this time either. So for the first week after surgery, you're just going to be on clear liquids until you see us in the office for your first post-op appointment. Your clear liquids include water, again, sugar-free, decaffeinated, non-carbonated clear beverages, your chicken broth, vegetable broth, beef broth that's fat-free, sugar-free gelatin, sugar-free popsicles, and also sugar-free sweeteners that we had talked about before. Full liquid diet is the next diet phase, so you'll be on the full liquid diet for another week. So again, doing the best you can, sipping on your 4 ounces of fluid every hour. Your protein shakes do count as your liquids, then they will keep you hydrated, okay? Add protein powder to full liquids as tolerated to get as much protein that you can throughout the day. Your overall protein goal is about 60 grams at minimum for our women and about 80 grams per minimum per day for our men. We do want you to avoid the use of straws for 6 months following surgery, as this can incorporate some air in your stomach and make you feel uncomfortable and gassy and bloated. We want you to avoid gulping, and we don't want you to use any chewing gum for the same reason as using straws. Sometimes that you can swallow air and make you feel uncomfortable and bloated. And also no alcohol at this time. The different full liquid items that you can consume include low calorie, low sugar, decaffeinated, non-carbonated clear liquids to stay hydrated. You can do your silk soy milk, you can do your skim milk or lactose-free milk, you can do almond milk, your protein supplements that meet our requirements, hot cereal that's thinned and soupy, which would include your oatmeal, cream of wheat, grits, your fat-free yogurt as well, decaf coffee or tea, vegetable juice, strained thin low-fat soups, and diet pudding. So again, you'll be on this for 1 week. For weeks 3 and 4, post-op, you'll be on phase 3, which is your pureed diet. So foods will consist of a blended or pureed and soft foods. This decreases the overall workload on your stomach and allows it to heal. Protein sources will be the main focus during the recovery time. Foods will move through your new anatomy more quickly than solids, so eat very, very slowly. That's important. Okay. So again, starting 2 weeks after surgery, and you'll follow this for 2 weeks. All foods must be the consistency of applesauce before consumption. If you don't have a blender, I usually recommend maybe purchasing one or borrowing one. This will make your life a lot easier. Eat and drink very slowly. Serving size should not exceed half a cup at each meal. And also, this is very important, no drinking with meals, so stop drinking 30 minutes before a meal and wait about 30 to 60 minutes after a meal before drinking again. We don't want you to really gulp, we don't want you chewing gum, and we don't want you to be consuming any alcohol. Pureed food items allowed. You can do low-fat cottage cheese or low-fat ricotta, sugar-free applesauce, egg substitute or egg whites, creamy natural peanut butter with no sugar added. We really don't want you to do more than a tablespoon of this a day. Pureed meats, you could do fish, poultry, pork, strained baby food meats if you want to do that. If the thought of pureed meats really kind of freaks you out, just make sure that you're focusing on adding protein powder to anything and focusing on those protein shakes. You can also do baby food, vegetables, and fruits. Mashed potatoes without the skin or without the skin, pureed fruits and vegetables without the skins or seeds, and canned tuna, chicken, salmon, mashed. Okay, and here's just some instructions on how to blend your food. So just cut your food into very small pieces about the size of your thumbnail. Place the food in a food processor or blender. You can add, liquid to cover, the liquid blades to kind of give it that consistency. You can use broth, skim milk, or low-fat gravy. Blend until foods are the consistency of applesauce. So obviously, your yogurt and cottage cheese do not need to be blended. Strain out the lump seeds or large pieces of food before consuming it. To avoid food wasting, freeze in ice cube trays, and then you can heat it up on the stovetop or in the microwave at a later date to, avoid wasting any food. Phase 4, this is your soft diet. So this is really when you're going to start chewing your food again. So all foods need to be soft in texture in order for the stomach to continue to heal. So 4 to 6 small meals throughout the day. Restrict the size of the meals to approximately half a cup. So this is just kind of a general recommendation. If you're not able to get it to half a cup, that's totally fine. Take super, super small bites and chew your food thoroughly before swallowing. So really this should be about 20 to 30 chews per bite. Your meals overall should not last, they should last about 20 minutes. They shouldn't really go over 20 minutes. And again, remember not to drink and eat at the same time. There's only so much room that you have in your stomach. We want to make sure that when you're sitting down for a meal, you're getting an appropriate amount of protein. So again, waiting 30 minutes before to drink and then 30 minutes after a meal to drink again. Protein goal overall, again, 60 to 80 grams. Continue using your protein powders, continue supplementing protein shakes at this time if you need to. It's very difficult to meet your protein needs with just your salad proteins at this time. High quality protein at each meal. No gulping, no chewing gum, no alcohol. Okay, so here's some things that you can consume on the soft diet. Again, this is phase 4, starting about 4 weeks after surgery, and you'll follow this for 2 weeks. So obviously, in addition to what you were doing on phase 1 through 3, you can now do dry cereal softened in low fat or fat-free milk, canned or cooked vegetables without the skin or seeds, moist lean protein sources like your chicken, turkey, fish, soft-boiled egg, shellfish, reduced fat cheese as well, mozzarella, provolone, cheddar, the Laughing Cow wedges, and there's also some different flavors here that you can try, mini Baby Bell as well, light mozzarella. And at this point, we still want you to avoid any breads, rice, and pasta. Okay, that's very important because these types of doughy foods can really, they can really expand in your stomach a bit and make you feel very uncomfortable. So phase 5, this is really, eating a balanced meal for weight loss and really transitioning to solids, trying one new food daily. Try it for 2 days to know how it will specifically affect you. Everybody's a little bit different in this case. Some people tolerate chicken, some people, tolerate shellfish and not chicken. So everybody's pretty different when it comes to this phase. Always, avoid any fruits and vegetables with skins at first. Eat softer fruits and vegetables first. Combine or pair your protein with your produce. Aim for 64 ounces of fluid daily. Again, no eating and drinking at the same time. Your volume of food can certainly vary from person to person. I think the overall, the biggest thing is really just making sure that you stop eating when you're satisfied versus overly full and overly stuffed and sick. More solid foods will keep you fuller and will help continue this weight loss. Remember, when you're drinking your calories, you don't really feel that restriction, okay? So just a couple bullet points here. Again, we talked about introducing new foods one at a time. Foods that most often cause discomfort are those high in fat or sugar. So really greasy foods or fried foods and really concentrated sweets like those that we talked about when we talked about dumping syndrome. 4 to 6 small meals a day. Take small bites and chew food thoroughly before swallowing. Again, at least 20 to 30 chews per bite. And really just kind of taking the time to eat slowly. A meal should last a good 20 minutes. Your fluid intake should be about 8 cups or about 64 fluid ounces a day. And this is really throughout the day. Make sure that you're sipping throughout the day. Again, protein goals, 60 to 80 grams per day. 60 minimum for women, 80 minimum for men. Aim for no more than 35 grams of fat per day, no gulping. Limit foods with a high caloric density. So this is a really important bullet point here to do the best you can with not gaining the weight back after surgery. So really when we find that some people gain the weight back or gain some weight back, This is when they are consuming like your chips and your pretzels and your Doritos and your Cheez-Its and your Goldfish, because you can consume a lot of these types of high calorically dense foods and not really feel a whole lot of restriction. So always go for your high quality protein in that produce to keep yourself, to feel that restriction after surgery and to keep the weight off. Drink mostly calorie-free liquids. Again, when you drink your calories, whether it's alcohol, whether it's, your juice, regular soda, things like that, you can gain some of the weight back very easily. Avoid the use of straws for 6 months following surgery to avoid, feeling bloated or gassy. Same thing with chewing gum and carbonated beverages. So again, all three of these, straws, carbonated beverages, and chewing gum, should be eliminated, or you shouldn't be using these for 6 months after surgery. Also avoid alcohol for 3 months following surgery and use very sparingly after 3 months. So alcohol is primarily absorbed in your stomach, and because your stomach is much smaller after surgery, you can get very intoxicated after drinking a very small amount of alcohol. So be very careful with that. And also alcohol is empty calories as well. So you don't want to jeopardize your weight loss and all your hard work by drinking alcohol after surgery. Overall, poorly tolerated food. So this is specifically and usually only the first 6 to 12 weeks after surgery. We want you to avoid spicy foods, acidic foods, rice, pasta, bread, or other sticky, doughy foods. Other types of foods like coconut, corn, popcorn, and whole beans or seeds that can be kind of stringy. Stringy vegetables like celery or asparagus, carbonated beverages such as soda and sparkling water, bran cereals, dried fruits, seeds, and skins of fruit at first, dry meats like chicken or fish, sugary foods included undiluted fruit juice, cookies, candies, other sweets and sauces and condiments that contain sugar or other sweeteners. These foods should be avoided for the long term overall. There are a lot of different brands that are now doing like sugar-free ketchup and sugar-free barbecue sauce and things like that, so that shouldn't be too hard to avoid. Caffeinated beverages, foods and beverages, caffeine should be avoided or restricted for the long term. Especially, I would say with caffeine, I would avoid any caffeinated beverages until you're able to meet your 64 ounces of your non-caffeinated beverages to stay hydrated, because caffeinated beverages don't really hydrate you the same way as non-caffeinated beverages. And then alcohol, as we just talked about. As more time passes following your weight loss surgery, add new foods cautiously, so really only try one bite at first. Some foods will swell in your pouch, like we talked about, like your rice, breads, pasta, things like that. If you eat too much of them, you will feel extreme pain. So it's important to really eat slowly and listen to your body. Your overall bariatric plate here, so about 3 ounces of your protein. Always eat your protein first. And then go to your non-starchy veggies. These are carrots, it looks like. There's a bunch of different non-starchy veggies, like your carrots and asparagus and things like that. And then also a little bit of your starch. So whether it's your potatoes, or your rice, things like that. Go for that last. Exercise is extremely important. We want you to start exercising as soon as your surgeon gives you the okay to start after surgery. Resistance and strength training will help you preserve your lean body mass or your muscle mass after surgery to speed up your metabolism to aid in more weight loss after surgery. We also want you to include cardio exercises as well. So start exercising at least 3 times weekly for 30 minutes minimum. The goal overall is 150 minutes or more a week of physical activity. And we actually really, overall want you to start exercising even prior to surgery. That will help facilitate weight loss. That will make overall surgery safer for you, which is very important.
We are now going to start part 2 of our presentation, the pre-op preparation. Okay, let's review our final steps prior to surgery. You will be having a pre-admission testing appointment with our anesthesiology team. This is likely going to be scheduled for you about 1 week prior to your surgery date. This is because we will be doing COVID testing at this time. Everyone must be COVID tested prior to surgery, even if you've been vaccinated or have already had COVID. If you are confused about when your pre-admission testing has been scheduled for, please reach out to our office. You will also have a consent signing appointment. This is usually your last office visit. At this time, you will go over the consent form with your surgeon. They will also be ordering you the Lovenox shots. We're going to talk more about the importance of these shots, but you should take note that these are ordered prior to your surgery, but they are to be used after. So we order them ahead of time so that you don't have to go to the pharmacy after your surgery, but you will be administering them after surgery. Your consent signing appointment will also be when we give you the antibiotic soap. This will come in a small blue bottle, and you will use it the night before surgery as well as the morning of. If you have not received this soap after your consent signing appointment, please contact the office. We'd like you to remember that you must stop taking any NSAID medications 10 days prior to surgery. This includes things like aspirin, Advil, Motrin, and Aleve. Tylenol is okay. As for your surgery time, you will receive a phone call the day before your surgery, and they will let you know what time your surgery is at and where exactly to report to. This will be the business day before your surgery. So, for example, if you are having surgery on a Monday, you will get a call on Friday. If you are having surgery on a Tuesday, you will get a call that Monday. As an important reminder, the day prior to your surgery, you can only have clear liquids. Please do not have anything by mouth after midnight before surgery. There are certain things you can do to prepare ahead of time for surgery. For one, you can be sure to stock up on all of your vitamins, Tums, clear liquids, sugar-free popsicles, Jell-O, and Crystal Light prior to surgery. You could also consider purchasing something called an abdominal binder that you see here in the picture. These can be found for only about $10, $15 off of Amazon or a medical supplies store. Patients say that this can help with muscle soreness after surgery. It is not a requirement though, just a recommendation. You should make sure that any medical equipment that you use in your home is working. Specifically, if you have sleep apnea, diabetes, or hypertension, please make sure you have the proper equipment. If you use a CPAP machine for your sleep apnea, you must bring this to the hospital. They will not provide one for you. And you do need it to ensure appropriate dispensing of your pain medication. So you will not be allowed to proceed with surgery if you do not have your CPAP machine. Additionally, if you do have high blood pressure and or diabetes, you should have a blood pressure cuff at home and a glucometer. This is very important because your medications will be changing very quickly after surgery, and it's likely that you will only need to take certain medications if your blood pressure is above a certain level. Same thing with your blood sugar. So if you don't have a way of checking this at home, that could be dangerous. If you don't have any of this equipment, please call your PCP's office, or if they're not able to help you, of course, you may call the surgery office. As for what to bring to the hospital, again, you must bring your CPAP machine. We do recommend putting a piece of tape on all parts of the equipment with your name on it. Any personal toiletries that you'd like, although it will also be supplied by the hospital. We will be giving you a water bottle at discharge, so you do not need to bring your own. And some patients do like to bring their binders with them so that they can refer to it. You don't need to. We will be giving you a discharge packet with pertinent information, but please make sure you know where the binder is. This is going to be a very important resource for you while you are at home recovering. I'd like to take a moment to review the anatomy of our surgeries. Many of you have not reviewed this since possibly your initial consultation. For those of you who are receiving the sleeve gastrectomy, the surgeon is going to be going in and removing about 80% of your stomach. And you can see here on the screen, this is what is being taken out and sent to pathology. This will affect your hunger because there are hormones in this part of the stomach that when they're taken away, you will no longer feel the same type of hunger signals and cues. You'll also be left with a very small tubular portion of the stomach. It's about the shape of a small banana or toothpaste tube. So you'll only have to eat a much smaller amount in order to feel full. You can see here on the screen that people can lose anywhere from 50 to 80 pounds. But I always like to point out that everyone is different. Some people can lose more than this, and some people can lose less. It's more about what you do with it than the surgery itself. This is our gastric bypass. This surgery is a little bit different in that nothing is being removed. So the surgeon is going to go in and put a staple line on to separate a small pouch from the rest of your stomach. They are then going to make another surgical point here to bring up the intestine. So food is going to enter your esophagus, bypass most of your stomach, and then rejoin the rest of the small bowel. The stomach stays in the body and does make gastric juices and enzymes, which will travel down and eventually combine with the food. This does allow for very rapid weight loss, like the sleeve. I have here that weight loss can be closer to 60 to 90 pounds with this surgery. However, again, everyone is different. We've seen people lose more and we've seen people lose less. I don't like anyone to get hung up on the specific numbers or to compare themselves to anyone else. We do have a third surgery that's not as common, but you may be receiving the biliopancreatic diversion with duodenal switch. This is only appropriate for those who are starting with a BMI of 50 or above, as it's intended for extremely significant weight loss, up to sometimes 150 pounds. This is again a two-part surgery and is sometimes done in two parts, with the sleeve-like portion being done first, and after some weight loss is achieved, the second part is done. But half of the stomach is removed, similar to the sleeve, but then the stomach is connected to the last 250 centimeters of the small intestine, and the remaining small intestine is connected 100 centimeters from the end of the small bowel, where the food will mix with the digestive enzymes. I like to review the possible complications that can occur after surgery. You have likely been briefed on this already by your surgeon, especially if you've already had your consent signing appointment. But we like you to be prepared and understand every possible risk, because no surgery comes without a risk. A stricture is something that can happen when there's a narrowing between the gastric pouch and the intestine, when we're talking about the gastric bypass, or a narrowing in the stomach portion of the sleeve. Food is unable to pass through, and so you may find that you're unable to tolerate food and possibly vomiting after you're eating. Generally, the treatment with this is an upper endoscopy, where the surgeon will go in with a small camera and balloon, and they'll blow up that balloon in order to stretch out the area that has been condensed. A leak is a very serious complication that could occur between the connections of the stomach and the intestine in a bypass or along the staple line of the sleeve. Everyone is tested post-operatively for a leak in the hospital, but it could also occur immediately post-op at home. Signs and symptoms would include a rapid heartbeat, severe abdominal pain, and fever. This could require a reoperation. You should know that leaks, while they could occur, are very rare. I'd like to talk about what you can expect after surgery. For those who are getting a gastric bypass, you will likely have a urinary catheter placed. This will be done while you're asleep in the operating room and is generally removed first thing in the morning. We will make sure that you are urinating normally on your own before sending you home. Nausea and abdominal soreness are two things that are very common after surgery. We want you to let us know, though, if something doesn't feel right or if these things aren't going away with pain medicine and time. If you have nausea that lasts for longer than a few minutes and is consistent in that first week after home, we would like to know about it. It really should be resolved fairly quickly. It's also very normal to feel soreness and some pain after surgery. This is a major surgery. However, usually that first day, either in the hospital or sometimes the first day home, are the worst parts of it, and it will improve gradually every single day. You should not be afraid to need pain medications, though, for those first few days or even a week. It's normal, and they're prescribed for a reason. Constipation is something that is very common after surgery. This is because you're on narcotics, the pain medications, you have decreased activity and probably decreased fluid intake, and you're also not eating solid food, so all of these things are a perfect storm for constipation. We ask that you don't go more than 4 to 5 days without having a bowel movement before contacting us. We're likely going to recommend something like milk of magnesia, Dulcolax, or even a suppository if needed. Sometimes you will be discharged home on liquid Colace just to prophylactically prevent against constipation. I'd like to talk now about how to stay hydrated, and this is something we're going to be emphasizing a lot, both preoperatively and when you return home. In the hospital, you're generally going to be started on fluids the day after your surgery. So you'll usually have surgery in the morning, and then the next morning, 24 hours later, we'll start you on the clear liquid diet. You'll be hooked up to fluids while you're here, and so we're not really worried about you getting dehydrated while you're in the hospital with us. These fluids are mostly intended to just make sure that everything is going down normally without any pain. We'll give you small 1-ounce cups and ask you to drink about 1 to 2 ounces per hour. Again, that's while you're here with us in the hospital. Your staple lines are brand new and swollen, so it is imperative that you sip very slowly. 1 ounce should take you about 15 minutes to get down and should be separated out to about 4 different sips. You'll be given clear liquids like Crystal Light, water, broth, and diet Jell-O. You may also experience a change in preference for liquid temperature, meaning that before surgery, you may have enjoyed drinking very cold liquids or very warm liquids. After surgery, though, you may find that you don't tolerate that. Generally, room temperature liquids are best tolerated. When you get home, you'll no longer be connected to the IV fluids, and therefore we're going to ask you to increase your fluid intake to prevent dehydration. You are going to aim for about 4 ounces per hour or 1 ounce every 15 minutes. This will total about 60 ounces for the entire day, and this is including all your clear liquids. So if you have some Jell-O or you have some broth, that counts as well. Remember, while the amount is very important, we still want you to be going very slowly. Why are we so obsessed with making sure that you don't become dehydrated? That's because this is the most common cause for readmission or coming to the emergency room, and we do not want that to happen to you. So you should know what the signs and symptoms are of dehydration. The most important one that you'll look for is the color of your urine and how often you're urinating. When you're home, you should be going at least 3 to 4 times a day, and you want it to be a nice pale yellow. Other possible signs of dehydration would be fatigue, nausea, dizziness, or extreme weight loss, although that's unlikely to happen in the very beginning. And why is it that it's hard to stay hydrated? Because your body is not going to ask you for fluid like it does prior to surgery. Right after surgery, the response is going to be so extreme that this on the left is going to be what you want, but this is going to be what you need. So if you rely solely on your hydration signals to stay hydrated, it will not be enough. I would also like to ask you to please stay on your clear liquids only until your first post-op appointment. If you've been reading your binder, which I hope you have been, it will say that clear liquids are for 1 week after surgery. However, sometimes because of the calendar, your first post-op appointment will be maybe 8 days after surgery. But we would still like you to wait to advance until we see you in person and give you the okay. Now I'd like to discuss how we can prevent pneumonia and blood clots after surgery. We will be giving you something called the incentive spirometer while you're in the hospital. This is to help clear up any phlegm that builds up in your lungs and to prevent you from getting post-operative pneumonia. We'll teach you how to use this in the hospital, although it's not hard, and we are going to ask you to use it frequently after surgery, about 10 times an hour while you're up. Additionally, we're going to be giving you post-operative Lovenox, which I did mention in the beginning of the presentation. This is to prevent blood clots, and it is an injection that you'll take post-operatively, meaning for that first 1 week after surgery. Again, it is a needle, but it is not very hard to administer, and generally we'll have the visiting nurse who comes to see you after surgery help you with this. To help the Lovenox work, we do ask that you get up and walk around about a couple of times a day. We don't want you sitting in bed all day because otherwise your blood won't flow. And remember, you'll take this Lovenox for 7 days after surgery. Things you want to remember after discharge, and again, we will review this with you in the hospital before you go home. You'll want to increase your clear liquids to 40 to 60 ounces daily and try and keep a fluid journal. We will be giving you one before you go home. Let us know if you're having any nausea or vomiting. You may shower the day after you get home, but please no baths, hot tubs, or pools until you're completely healed. We will be arranging for a visiting nurse to come visit you when you're at home. They will help you with the Lovenox injection and take your vitals and make sure everything is okay. Remember to take this time to be a patient and allow yourself time to heal. Please keep in mind that no two patients are alike. This goes for every part of the process. Some patients get through the process in 4 months, some in 6, some in a year. Everyone is different, okay? Some people stop taking pain medicines the day after surgery. Some need it for that entire week. That's okay. Some patients find that the weight comes off quicker. Others find that, yes, it may be consistent, but it's slower. Many of you may have friends who have had weight loss surgery, and it's great to talk to them about your struggles, your successes, and so on. But do not compare yourself to them. Also, please take advice from only those on your healthcare team. Well-meaning healthcare providers may mislead you because they don't understand your specific operation. For example, someone may think that clear liquids could include 100% apple juice. Maybe they're even in the health profession. But you know that on your clear liquids, you cannot have any sugar. We've trained you well, and you should really trust your instincts. And the third thing, please bring any questions to us. I hope you know by now that we're here to help you and support you, and nothing is trivial. We would much rather hear from you than not. I want you to think about support group and consider making it a priority. We hold support group the first Wednesday of every month from 5:30 to 6:30. Please check in with us about whether it will be virtual or in person. It's a really helpful time to come together and talk to other people who are experiencing similar things. Please don't forget to complete your quiz after this video is over. You should have received this quiz when you either started the program or when you chose your surgery date. You can complete it and either return it to us in person or email us. We'll go over any questions that you may have. Lastly, let's remember why we're here. You've done a lot to get here, and I can promise you that not everyone who starts the process gets to this point, so you should be proud of yourself. You should also remember why it was that you decided to pursue weight loss surgery in the first place. Sometimes people want to get off their diabetes medication or their hypertension medication. Some people want to be able to keep up with their grandkids or their children. Others want to do smaller things in life without trouble, like tying shoes, riding a roller coaster, or going on an airplane. There's many different reasons why you may have called us, and you want to remember what those reasons were for you. Thank you guys so much for attending our presentation, and please remember to reach out with any questions.